So today we're going to be performing an IV insertion. I'm first going to start off by verifying hospital policy and verifying the order. Then I'm going to perform hand hygiene and do the two identifiers, Jaguar J. Jones, MR number 4176352, MR number 4176352. I see his allergies are penicillin and he has a penicillin allergy band on. I would ask him if there's any other allergies I need to be worried about. I would explain the procedure. So today we're going to be doing an IV insertion. Then I would provide privacy for the patient. I'm going to move the trash can, perform hand hygiene, put on my goggles. I'm going to say the 3 principles for selecting a vein, which is make sure to do it at the most distal site. Try to use the non-dominant hand if able, and then avoid flexion sites such as your wrist or antecubital. I would do 3 principles for fostering venous distension would be applying warmth for vasodilation for a few minutes, lightly stroking the vein, and dangling the arm or putting it in a dependent position for blood flow. So now we'll be cleaning the insertion site, now we're gonna prime. Gonna loosen this. Okay, so now we'll be putting on the tegaderm 4 to 5 inches above the insertion point. Okay, so now I'm going to perform hand hygiene, put on my gloves. I'm gonna now clean the site with my chlorhexidine, going horizontally, vertically, and in circular motions for 30 seconds, and then I would wait for that to dry. I would grab my catheter, my IV catheter, so I would check the radial pulse, make sure it's still there, or you can still feel it. I would make sure that the vein that I picked is still good for use, and then I'm going to anchor down on the vein, go in at a 10 to 30 degree angle, bevel up. So I'm gonna wait for blood return, advance another 1/4 inch, apply pressure, advance the hub, not the stylet. Then I'm going to be popping the tourniquet. I'm gonna take out the stylet. Then I'll grab this quickly. I'm gonna insert it. I'm gonna grab this and hold it so I can put the temporary tape on. Okay, so now I would aspirate, and then I would flush the rest of the saline in, and then I would observe for any swelling, and then I'm going to disconnect, put in the sharps container. Now I'm going to be applying the tegaderm. I would put, I'm going to put a piece of tape. It's going to have my initials, time, and date on it on the side of the tegaderm. And then I would now put a piece of permanent tape on instead of the temporary. Okay, so now that I have the permanent tape on, I'm going to gather or get rid of all my supplies. Safely. And then I'm going to make sure the patient is back into is in a comfortable position. That we lower the bed all the way. That we raise the side rails. I'm gonna take off my gloves. And I would also tell the patient about the signs and symptoms of how to prevent dislodging an IV, and then I would make sure that they knew the signs and symptoms of IV complications, which are infiltration, inflammation, and phlebiasis. And so now we'll be doing, and I would perform hand hygiene. I'm going to make sure that I'm going to document. I'm going to document the date and time, the location, the number of attempts, the catheter gauge and gauge and length, and then I would also document how the patient tolerated the procedure, how if there was the presence of a saline lock or and then I would the method or the flow rate, flow rate and method of the fluids if they're prescribed. And then yeah, I think that is it for documentation. So now we'll be coming back into the room to take out the IV. I'm gonna wash my hands or perform hand hygiene, make sure that the patient is at a working height, lower the side rails, that they're in a comfortable position. I'm gonna be putting on some clean gloves. So now I'll be taking off the tegaderm towards the insertion point. Okay, so I would discard that, and then I will be taking off the permanent tape. And then I will now put pressure with the gauze. I'm going to remove slowly and steadily. I'm putting this into the Sharps container. I'm going to apply pressure, and then I will tape that down. While I have I would look for any. I would have looked at the intactness of the catheter tip, and then I would see if there's any redness, swelling, drainage, pain or tenderness, and then I'm going to apply this piece of tape, and now I'm done.